it's me, Carly Quill, and this is Online Life Practical 3 Axial Muscles Part 2, thanks to e-learning because of the coronavirus. I had some technical difficulties, so I actually lost this half of my lab practical and had to completely redo it. So, this is not the best night for me, but we're going to make it work. Okay, so we're going to start off with the muscles of the neck, which is where the last video left off. Beginning with the platysma. And the platysma is really cool because it takes up this whole part right here. And it originates at the fascia over your chest, which is kind of like this connective layer. It's pretty much all you need to know. But it kind of starts right around like your collarbones and like your first few ribs. As you'll see right here, it just kind of goes right there, and it connects almost in a jagged way at this fascia right here. So, it's going to originate there, and it's going to go, the fibers run up at the lower margin of the mandible. It's going to insert at the skin and corners of the mouth as well, which is why you can see in this picture, whenever I contract the platysma, it also makes my mouth frown and everything. So it depresses your mandible, it pulls the lower lip back and down, and it tenses the muscles of the neck. Now, tensing the muscles of the neck is like the number one reason you have platysma. But it also is like super important for depressing your mandible, because you notice that all of like the chewing muscles that we covered in the last one, or for pulling your mandible back up. So this one is for pulling your mandible down, which makes it really cool. So you see how it's going to pull. It's going to pull your mandible down because it always pulls towards the origin. And then we're going to go to the trapezius. And the trapezius originates at the occipital bone, the spines of the C7, and all the thoracic vertebrae. So it's really cool, and you'll see that when we get to the skeletal model of where it originates and inserts. It inserts on the acromion and the spine of the scapula, which is the part of your scapula that you kind of feel as like a ridge, and the lateral part of your clavicle, your collarbone. It's supposed to stabilize, elevate, rotate, and retract your scapula, and it extends the head. So when I think about the trapezius, I think about shrugging my shoulders, like, I don't know, because that will be elevating the scapula. Yeah, so you'll see here on this model, it's right here. It kind of forms like the back of your neck, and it kind of creeps around till your the lateral part of your clavicle. So you'll see right here, it's gonna originate all down here. It's gonna kind of go. It has a really cool shape, almost like a diamond kind of thing. I think it's pretty cool. So that's your trapezius. And then you're going to have your sternocleidomastoid, which originates at your manubrium, which is the top part of your sternum, which is where you get the sterno. And then it's going to insert at the mastoid process of your temporal bone. That's where you get mastoid. And your mastoid process is this little thing back here behind your ear. It's like a little projection of your temporal bone. And the superior nuchal line of the occipital bone, which is a ridge on the back of your skull. You can kind of feel it, not really, but it's at like the base of your skull. And its action is flexion and rotation of head. So flexion of your head is what you see right here, where I'm bringing my head towards my chest. So you see here, it brings towards the origin. It's pretty cool. But see here, this is your manubrium. It's like the hilt of your sword. And then this is your mastoid process of your temporal bone. So sternocleidomastoid is a very sensational name for a muscle, and as that's what Dr. Igwe said about it. It's always been my favorite, but I think it's really cool that she says it's because it's sensational. I was like, wow, that is a really fancy name for a muscle. And that was a blank slide, I forgot. So your anterior deep prevertebral muscles are kind of non-specific. They originate at cervical vertebrae and cranial bones, and they insert on thoracic vertebrae and cranial bones. So just depending on which way they run. But you see how they're going to be, see how these ribs are going in like that. So that means this is, they're on the part of your spine, like they're on the inside. So they're not at like you get the back of your neck. They're like in your neck. So they're going to be on the anterior side of your vertebrae, which makes them really cool because they're going to aid in flexing the neck, bowing the head, and tilting the neck. So they just kind of help you like maintain control of flexing your neck. It's actually a pretty interesting group. They're all really like weird names, and they're all so small that you don't really have to be specific about them, but just like they're on the inside, and that's what really matters, because there's kind of a group that's the opposite of them that's on the outside, on the posterior, which is what we're going to cover next. So the posterior deep postvertebral muscles are these on this side, the smaller ones. The other ones we're going to talk about in a second. Disregard those bigger ones. We'll come back to them. So these are going to be the deepest postvertebral muscles. They're going to be the ones that are like right up in there. And they originate on, again, it's kind of non-specific because there's a bunch of them that we didn't have to be totally specific about, but they originate on some vertebrae and they're going to insert on other vertebrae. And as a back muscle, they work with other back muscles to support posture and assist in moving the spine. So they're just kind of back there helping you out, helping you stand, holding everything together. But what's important to know is that they are at the deepest. In contrast to, that was the neck, here comes the trunk. In contrast to the erector spinae. So the erector spinae are the ones that are on top of these that we just covered. They're going to be these bigger ones, and they are also a bunch of different ones. So the origin and insertion, again, non-specific because we're talking about a group, but they originate on the iliac crest and transverse processes of vertebrae, and in some places even the ribs. So you can see right here how many connections they make. Here, I'll go with a different color. You can see how many connections they make to different places. And they insert on the ribs and the transverse processes of the vertebrae, and one even inserts into your mastoid process, which again is this up here on your temporal bone. So their action is to extend laterally and flex the vertebral column, and in some cases the head. So when I think about what these can do, I think about whenever you're trying to, like, somebody says sit up straight and you kind of overdo it and you push your back in like that. See if you can tell on mine. I'm kind of like a normal and then curve it in. So flexing your vertebral column, just kind of really overdoing it on posture is what I think of erector spinae. So it's really important to know that like they help with posture, they keep us erect, and spinae being spine. So it's kind of, you can use your context clues on that one. Yeah, I think that's all. So your external intercostals are in between your ribs, your costal bones. So they're intercostals. They're between your costals. The external ones you see here, they're the ones that are running like this. They kind of stop right here. They originate on the inferior border of the rib above, and they're going to, that's the origin. They're going to insert at the superior border of the rib below. So, how do I illustrate this? So if they insert right here, they're gonna pull your rib, the other end of the muscle, towards the origin, which pulls the ribs together in a chain reaction, and it elevates the whole rib cage for inspiration for you to breathe in. So you can see here how my rib cage is like normal, just kind of chilling, and then we move it up just to take in more air, as part of with, we're going to find out the diaphragm is the prime mover of inspiration. But in contrast to the external intercostals, which are right here, and you'll note that they run like this, which is super important, I think. They run from the external. That's what makes sense to me. They run from further away from the body, so they run from the external side to the internal. And then contrastingly, the internal intercostals are the ones that are right here, and they run like that. So they kind of do the opposite. If I'm breathing in here, they're going to take me down, because their origin is the superior border of the rib below. So origin, insertion. So they're going to pull the insertion towards the origin. It's going to pull everything back from where it just was. It's going to depress the rib cage so that you can exhale. It's kind of weird to learn about these because then you start thinking about it, like what do I look like when I breathe? But these kind of work as a pair and go against what each other does. So with the internal intercostals, you'll notice they run like that. So I think they run from the internal, if I can write. So they run from the internal to the external. That's what I think of to remember that they are the ones that move that way. And there's the diaphragm. So all of those two last ones and the diaphragm are really important in breathing. So breathing in is inspiration, breathing out is expiration. So you have your diaphragm here, which I'm sure you've heard of because of whenever you're hiccuping, they say you just need to reset your diaphragm. It has something to do with the vagus nerve, not the diaphragm, but I digress. So the diaphragm originates on the inferior border of the rib cage, so you see right here, and the sternum and the costal cartilage. So you'll see on the skeletal model it make more sense, but it inserts on the central tendon, and the central tendon is this yellow stuff, or not this yellow stuff, this white stuff right here. So the central tendon's honestly just chilling up in there, and it just is there to help your diaphragm out and your internal organs out. And the diaphragm is the prime mover of inspiration. It increases the intra-abdominal pressure, which helps you take in more air. So you see how it helps me breathe in, brings me up. So you see here that it's on this border of your rib cage and your costal cartilage, and even your thoracic vertebrae. It kind of holds on, it kind of holds on to them. So it kind of makes like, I think about like when you're in elementary school and you're playing with the what are they called? With the parachute. So I think of like the parachute. It's just a parachute that helps out the inside of your body, helps you breathe. It's a super strong muscle from what I hear, but it tears a lot. Diaphragmatic hernias. So I might be wrong about the strong part. I do know about hernias. But so it inserts up here. This is where theoretically you'd see the central tendon. The rectus abdominis are your abs, which you can hilariously see. I haven't worked out in a very long time. So your rectus abdominis, they're your abs. So you notice that with the abdominal muscles, it's really important to look at how the fibers run. So you can see these fibers run straight up and down, which is going to set them apart. And then they have these little white lines on them, which we're going to talk about in a second, are tendinous inscriptions. So these are going to originate at the pubic crest and pubic symphysis. They're going to insert at the xiphoid process in the costal cartilage. The xiphoid process is this little thing right here. That's the end of your sternum. It's the pointy end of your sternum. And costal cartilage right here. So it's going to flex and rotate your lumbar vertebrae region and stabilize the posture muscle. It enables curling. Or crunches, as I call them. And that's what you see like the celebrities having an 8-pack, but the reason they would have this 8-pack, we'll talk about in a minute. So the rectus abdominis, it inserts up here, it originates right here. So you see it just kind of takes up, it's a big muscle, it takes up a lot of the front of your abdomen. And then the tendinous inscriptions are what give you the Hollywood abs, the washboard abs, because they are these little connective tissue lines that they don't really grow or anything like that with your muscle, but they definitely like they stay there and they keep it tight in that area, so that if you're strengthening those muscles and you're exposing those muscles, everybody has the tendinous inscriptions, but you'll be able to tell that they're there more the more toned you get. So there are these little white lines of connective tissue that run transversely on the rectus abdominis muscles. So if you could see, I don't have both of the rectus abdominis muscles, so really they look more like this. And that's these right here that I'm doing in green are your tendinous inscriptions. And this is your linea alba, which we'll talk about in a second. So your external oblique, it's really important to note how the fibers run on this one. So your external oblique is going to be the oblique on the outside, and it's going to run like this. So it runs kind of downward and to the side. It originates at your ribs. It inserts at your linea alba, which we'll talk about in a second, which is this right here, this line. It runs under your rectus abdominis. It's going to insert at your linea alba, your pubic crest, and your iliac crest, which are right here. And it's going to flex vertebral column, rotate your trunk, and do lateral flexion. So you see how I'm rotating my trunk? That's because of my external and internal obliques. They actually do the same movements together, but they're two separate muscles. So there's your insertion and your origin. It's kind of hard to draw on the skeleton, but it inserts in between the ribs in like a jagged kind of motion, and it takes up this whole space under your rectus abdominis, but above your internal oblique. So your internal oblique run like this instead. Well, actually, hang on, let me backspace that. They're going to run like that towards your linea alba. And they originate at your lumbar fascia, your iliac crest, which is right here, your inguinal ligament, which is also right here. It's going to insert at your linea alba, your pubic crest, and your costal cartilage. Its action is the same as its brother, the external oblique. It's going to help you flex your vertebral column and rotate your trunk, just like me. Please ignore the pajama shorts I'm wearing. So your internal oblique, while again hard to draw, like weaves in between, kind of in a jagged pattern on these ribs, and then it just kind of takes up this little area. So your transversus abdominis is actually kind of easy to remember because it runs transversely. It's going to run like straight across, not up and down or anything like that, just straight across transversus. It originates at your inguinal ligament, your iliac crest, your costal cartilage, and your lumbar fascia. So it just kind of goes across. This is the best view I could get of it on this model, but it's not like on the popped off shell of your belly. Its insertion is at your linea alba and your pubic crest. Its action is to compress the abdominal contents. So I think about sucking in the fat. Like if you're ever trying to get in a good pair of jeans and you gotta suck in, I think about my transversus abdominis helping me out, which is what this picture is of me doing, but I didn't do a very good job of it. So your transversus abdominis is really big and it runs right here, which makes sense as to it would take up this whole space. So like sucking in your belly would be its job. So your linea alba, which is super important, even though it's not a muscle, you notice that we talked about it a lot because it's a connective tissue band that runs down the middle of those abs. It originates at your sternum, so up here, and it's going to insert at your pubic symphysis, which is the junction of your pelvis, so right in the middle, run straight down the middle of your belly. And Dr. Igwe actually told us about how when you're pregnant, you get a white mark. If you've ever had a baby, you have a white mark from your linea alba, alba meaning white, line. So when it gets stretched out, like it stays with pregnant women, which I thought was super cool. But it's really important for the muscular system because it is a point of attachment for a lot of your abdominal muscles. If you think back to what we've already covered, the linea alba you've heard it a million times and you've been like, what is that? So it's the line that runs down the middle, and it's white because it's connective tissue, it's not a muscle. So right here you see it goes down to down. So the inguinal ligament is another connective tissue that isn't necessarily part of the muscular system, but it's really important because we've mentioned it as a point of attachment, and it provides structure. So it's a landmark of what holds the axial muscles in place, and even what holds some of the appendicular muscles in place, and therefore like what brings it all together from your body to your legs. So it originates at the inferior aponeurosis, which is a fancy word for, you've already seen in the last video, connective tissue. There's not only one of them, there are a lot of them. On the external abdominal oblique, which is what we've already covered, is back in here somewhere. It inserts on the pubic tubercle of the pubis, which is right here, on its inferior and medial end. So it's going to go all the way around and back. Its action is to support muscles and support nerves and blood vessels. It's very important for hip movement. Your inguinal ligament is huge for holding everything together. So you see right here, it's going to run all the way around and kind of be a landmark for all the muscles right here to hang on to. So they hang on to this linea alba. Can't really see it. They're going to hang on to this linea alba, and they're going to hang on to the inguinal ligament. So they have anchors in both directions. So that way it all stays together and you can hold your internal organs in peace. So yeah, that kind of concludes everything, and thanks for coming. hopefully I made some sort of sense and this isn't too terribly hard to grade. Thanks.